Good evening. How many nerves or the cranial nerves found in the brain? So there are 12 pair nerve, 12 pair, not the 12. We can tell 12 pair. Okay. Yes. How many meridians we have in the human body as per the acupuncture? We are not talking about the extraordinary meridian. We are talking about the only meridian. 12 meridian. Okay. So 12 cranial nerves and the 12 meridians. So each cranial nerves having connection with one body meridian. If we look at this chart of the cranial nerves, so cranial nerve number 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, and 12. There are many persons suffering with the cranial nerve problems like the vagus nerve is the very famous nerve. We are knowing that. If there is a problem in the cranial nerve number 1, the person is having problem of smell. If the problem with the cranial nerve number 2, that is the optic nerve, means the nerve which is having connection with the retina, eye, or the deeper part of the brain, retina. The third nerve also having connection with the eye. The fourth nerve also connection with the eye. The sixth nerve also having connection with the eye. And the fifth nerve having connection with the eye as well as with the face, the trigeminal nerve. So we can see from this 2 to 6, there are many nerves working on the different parts of the eyes. Then the seventh nerve is having connection with the face, that is facial nerve. Then eighth nerve is having connection with the ear. If there any problem in the ear, we can balance this nerve, vestibulocochlear. The ninth nerve having connection with the throat. There are many types of the throat problems. Okay. And the vagus nerve, we know, vagus nerve is the parasympathetic nerve controlling many things together. So the vagus nerve is the biggest nerve. Okay. There is any problem in the 12th nerve, the person might suffer with the shoulder pain, neck pain. And the 12th nerve is having connection with the tongue speech. So we know there are many persons having problem with the nose, the many problem having the problem of the eyes or the face, or the ear problems, deafness, throat issues, the multiple type of the throat problem, thyroid, tonsillitis, pharyngitis, laryngitis, the problem of neck and shoulder, and the problem of tongue and speech. So we have to treat the cranial nerve also. Many times person is having some blood clot in the brain, some compression of these nerves due to high blood pressure, due to some other problems, then the person might suffer with the various issues. So this is the chart of the 12th cranial nerve, and we should remember, okay, we should remember at least in a simple language. If we do the comparison as per the acupuncture, these nerve having connection with meridians that I will discuss maybe in the next class, that each cranial nerve is having connection with the one meridian. Okay, like the first nerve having connection with the kidney meridian. Okay, so if there is any problem in the first meridian, and if you are an acupuncturist, or then you can balance the kidney meridian, then you can improve the first nerve. In this way, the each and every nerve having connection with the 12th meridian, we'll be discussing this connection in the next class. But right now we are talking about these nerves are very much important. Let's focus on the third, fourth, fifth, and sixth nerve. Third, fourth, fifth, and sixth. The third nerve is having connection with the eyes. The fourth nerve also having connection with the eyes. The fifth nerve having connection with the eye and face. The sixth nerve also having connection with the eyes. So these all the nerves, third, fourth, fifth, and sixth nerve having connection with eyes. Okay, it means if the person is suffering with a eye problem, vision problem, many types of the vision problems, then we need to focus here. Okay. The person might be, one patient came and he told me that he can not see left side. Okay. From the right eye, also he cannot see left side. And from the left eye, also he cannot see left side. See, from both eyes, he cannot see left side. And from both the eyes, he can see front and the right side. Okay. Why this? Oh, because if the person is having eye problem, okay, then person should, if the person is having problem in the right eye, yeah, person is not able to see from the right eye, whether here, front or the right or left, anywhere. But these type of the problem happening because of the nerves. Okay, some nerves are having some jig cross, crisscross and all, right? Fine. So we are focusing on the third, fourth, fifth, and sixth nerve, and these nerve having connection with the eyes. Suppose you want to treat the eye problem. What is the eye problem? I want to treat vision problem. I want to treat, oh, high pressure in the eyes, glaucoma. I want to treat some problem in the retina, some problem like the macular degeneration in the eyes, or the high pressure in the eyes like glaucoma. It's a very common problem. Okay, it's so damaging the vision, and even person might suffer with the blindness if you're not treating on the time. So I want to treat the eyes. Okay, then how can we treat eyes using our osteopathy science? Okay, then we should know the entire path, how we can improve the circulation in the eyes, in the barriers part of the eyes, and how can we do the unwanted removal of toxin. So we are doing removal of toxin by veins, because arteries are bringing the good and blood with the full of oxygen, and the veins are taking the blood back to the heart again for the purification. Okay, so there are step-by-step guideline. Okay, do this treatment here. Okay, then do this treatment here. Do this treatment here. Do this treatment here. So we are doing the treatment in the chain, and we are covering entire path from heart to eyes. Results: we can treat the multiple problem of the eyes and with only very gentle touch. So it's not only eyes, the each and every part of the brain having supply of the blood. So pure blood is coming, and then the cells of the brain using this blood, using the oxygen, then this impure blood going back to the heart. So let's see, start from the heart, and we'll see now how the blood is. So with this red means pure blood. Okay, it's going in the various part of the body. And this blue means impure blood. Now it's coming in the heart for the purification. Okay. So let's try to understand simply. This is the heart. Okay. We are dividing the heart in the four part. So this is the right part of the heart and the left part of the heart. We are telling it right atrium. This is the left atrium. Then this one is the right ventricle. And this one is the left ventricle. Okay. So impure blood from entire body coming in the right atrium. This is the right atrium. This is collecting impure blood from entire body. This one. So the blood is coming from the head. Blood is coming from the lower part of the body. So whether blood is coming from the upper part of the lower part, okay, with the biggest pipeline. So this is called superior vena cava. And this is called inferior vena cava. The inferior vena cava bringing blood from the entire body, and the superior vena cava bringing blood from the upper body like head, shoulder, arm. Okay. So the blood will be coming here. Then the superior vena cava dividing in two parts because it has to supply the right part of the brain and the left part of the brain. Okay, so superior vena cava dividing in two parts. So let's see in this image here. So this is the superior vena cava. Okay, collecting blood from the upper body and having two divisions. One is coming from the right side. One is coming from the left side. Because this blood is coming from the head. Head means cephalo. Head means cephalic. This blood also coming from the arm. Arm means brachial. Okay, so we are telling this vein is called brachiocephalic vein. So brachiocephalic vein bringing the blood from the head and arm. The other side of the brachiocephalic vein also bringing the blood from the head and arm. So that is called brachiocephalic vein. So brachiocephalic vein then going down and bringing blood in the superior vena cava, then it's going in the heart, okay, for the purification. Then heart is doing the purification and mixing oxygen with the help of lung. Now, let's go little upper. Now let's move to the in the upper part. Sorry. So let's see now. So this is the superior vena cava, two parts, right brachiocephalic vein and the left brachiocephalic vein. Now we can see. Now this brachiocephalic vein having two divisions, one going in the arm and one going upward. Or we can tell one is coming from the arm and one coming from the head region. So this coming from the arm, it is called subclavian vein. And the coming from the head region, it's called internal jugular vein. Okay. If it is coming from the right side, right internal jugular vein. If it is coming from the left side, left internal jugular vein. In the short, we are also writing internal means eye, jugular vein. Yes, yeah. Yeah. So finally, now we can see here we are moving in the internal jugular vein. Now, how to feel the internal jugular vein? Where to feel the internal jugular vein? If you want to feel the internal jugular vein, you can feel here from the Adam's apple, the Adam's apple, we can see many person having one protruded part here. From the Adam's apple, if I go on the side of this thyroid cartilage, if I go in this depression I can feel here internal jugular vein. I am reaching on the internal jugular vein. Here I am having carotid artery as well as the internal jugular vein both. So if I'm touching here, I'm pressing here in the acupuncture, we are telling it stomach 9. Stomach 9 point here. Stomach 9, one of the great point for high blood pressure. If I'm pressing the stomach 9, I am touching three structure here. Number 1, carotid artery. Number 2, this vein, internal jugular vein. Number 3, vagus nerve. Okay, because vagus nerve is the 10th cranial nerve. Just we have seen it's starting from the brain and it's going in the entire body. So three structure, they are in one pipeline. All the three structure in one pipeline going from here. So if I go here, I can touch that pipeline, and in that pipeline I will stimulate all the 3 points. That's why we are not doing vigorous stimulation. It might harm this area. But stomach 9 stimulation is very good for two problems. Number 1, for high blood pressure, and number 2, for cough and cold and the lungs problem. In the scalp acupuncture, when we are pressing this point and person is having pain, then we are telling, oh, your lungs is weak. So in the scalp acupuncture, this is the diagnostic point of lung. We are pressing here, oh, I am having pain. Then in the acupuncture, we are putting lung point. Okay. And we have to balance the lung. So there are stomach 9, one of the great point. Okay. So now we are going, this internal jugular vein is going like this, and the subclavian vein is going like that. Okay. So from the heart, superior vena cava, then brachiocephalic vein this side, brachiocephalic vein this side, then this brachiocephalic vein dividing into two parts, subclavian vein and internal jugular vein. Now internal jugular vein, two internal jugular vein is coming here. Now it's beating. It's telling the different structure of the brain, okay, bring the blood. So the anterior part of the brain, middle part of the brain, posterior part of the brain, each and every part of the brain, bringing the impure blood and putting in the internal jugular vein, then internal jugular vein bringing it, then going in the brachiocephalic vein, then from the superior vena cava, and then heart. Clear? It's clear? Now, if I want to treat the eyes, if I want to treat the various part of the brain, so I should know the